This episode was pre-recorded as part of a live continuing education webinar. On-demand CEUs are still available for this presentation through All CEUs. Register at allceus.com/counselor toolbox. I'd like to welcome everybody to today's presentation. Today we're going to be talking about relapse prevention for addiction and mental health issues. And one of the things I'm going to start out, and if you've been to my classes before, then this is going to be old hat for you, but for the new people, I really look at, when I talk about addiction or mental health, I'm really thinking co-occurring, because we know that they estimate 47% of people struggle with addictive behaviors, and we know that somewhere around 30% of people have some mental health issues going on. We also know that when people are in active addiction or recovering from active addiction, it's almost always true that they're going to have some sort of mental health stuff going on because their neurotransmitters are out of balance. And the reason for that could be different for a multitude of reasons, but we want to realize that if somebody is depressed and sober, they're not going to stay sober for very long if that depression is oppressive. Likewise, if they are feeling pretty good but they're using, then the using is probably going to muck up their neurotransmitters and they're going to have a relapse of their mental health issues. So when I talk about relapse, I talk about relapse in terms of the whole person, in terms of mood and behaviors and urges. So this is going to be a broader relapse prevention than maybe you might be used to. So we're going to define relapse, identify relapse warning signs, identify people's strengths, because when people are in a place where they're getting ready to relapse, they've probably been walking down that path for a while, and this is kind of their black swan, and we'll talk about that. But when people are in a place where they're getting ready to relapse, they're in a bit of a crisis. So having them start with a tool that they've never used before is going to be less effective than saying what's worked before, when you've been able to stay clean, when you've been able to be happy, when you've been able to not be anxious for an hour, for a day. What has worked? I'm not talking about 2 weeks, 6 months, whatever. I'm talking about small goals. Let's not start setting goals that are too high right now. If somebody is really struggling just to get through this minute, let's figure out how to help them get through this hour, and then maybe the rest of